Nairobi County for 60 days. After that, of course, the by-election will happen. Now back to health. Kenya now faces complete paralysis of health services as doctors join nurses and clinical officers in their strike to push for better working condition and enhanced allowance, among other issues. Doctors had suspended their strike for 14 days to allow for more talks with the government. Let's talk to Dr. Chibanzi Mochonda, the KMPDU Secretary General, on their strike. I trust we can hear you well now. Thank you very much for making time to join us here on News Center. The strike is on. It commenced at midnight. Initially, you had suspended it for 14 days to allow talks. What happened to those talks?
We continue to talk with government even as we speak. The only challenge we faced over the last 14 days is that solutions have been put on the table, but the implementation is the most difficult thing we are dealing with now. So it's very difficult to let our members continue to work in very difficult conditions without assurance, implementable action. Also, what we need right now is action from the various government agencies to basically implement what is on the table, and that's what is agreed. I think we shall be able to be in a position where our members will continue working.
About implementing action, for the sake of our viewers, what exactly is on the table? What was discussed?
No, you see, there's still issues that are yet to be resolved fully. Like if I started, the first thing, we have the comprehensive group life, WIBA, group personal accident cover. It has excluded doctors in the county government, doctors in the university, and doctors in the parastatals. So there must be a decision that is made to bring on board these doctors to be covered in case we lose any one of them. The second issue that is yet to be have an implementable action is the issue of NHIF comprehensive cover. We have over 20 counties that are not in any form of cover, and so doctors are not assured of treatment. As we speak, in NMS, the AR insurance cover was cancelled, so the doctors are not insured in any way in case they get sick. Continue, we need the doctors working under contract. Most of those isolation treatment centers extended their contracts. We need employment of additional doctors to help the workforce that is currently on the ground. We also require that the risk allowance that we had put forth be considered and be brought back for the motivation of our healthcare workers. And of course, the ultimate long-term solution to most of these issues is the Health Services Commission. We still have doctors at the Ministry of Health and the universities that have their allowances yet to be paid from 2017, and yet we finally return to work agreements, and we have a CBA in place. So the discrimination of pay, especially at the Ministry of Health and the university, is moving forward. So, and then, of course, we have the doctors, the CT and Kirinyaga, that really need to come on board to help in this COVID-19 response.
You've talked about the comprehensive health insurance cover. I think on 10th of December, during one of the sessions, National Treasury committed to release 520 million towards the same. Wasn't this implemented?
Not yet implemented. As we speak, our members are still exposed. They have no cover.
All right. Now, Health CS Mutahi Kagwe on Friday did threaten to sack striking health workers. What are your reactions towards this?
I think first and foremost is to say that these grievances are real. These grievances are very genuine. So what we as KMPDU would like to urge the CS Health is to approach the matter with that, to seek a solution, not to make a situation that is already very delicate work. So most important is to be sensitive to the frontline soldiers, the doctors, and the remarks really will determine how we get out of this situation. So what we are more interested in is solutions. Let us focus on the solutions. Let us not intimidate doctors. Let us not threaten them, because that will not really help this situation.
All right. Finally, as you plan to lay to rest Dr. Stephen Mugusu, who is said to be laid to rest today, KTN News spoke to NHIF CEO, and he did mention that he will cater, well, NHIF will cater for all the bills of medical workers who are admitted in public hospitals. Has this been implemented?
That is dependent. NHIF comprehensive medical cover in itself is not able to cover for COVID for the healthcare workers. What will cater for COVID for the healthcare workers is the additional cover of the group life, WIBA, because that now is very comprehensive from treatment to demise. And that is what we are saying, that civil servants are covered, yes, but there is discrimination because the large group of doctors in the universities, large group of doctors in the county, and in the parastatals are not party to this cover. And that's why we want them brought on board so that everyone is covered fully.
All right. Thank you very much, Dr. Chibanzi Mwachonda, KMPDU Secretary General, for making time to talk to us here on News Center. Of course, as I mentioned earlier, doctors' strike commenced at midnight today. Of course, they are now joining health workers who are on their third week today. Of course, so many questions yet to be answered. We'll be following up on that here on KT News. Back to Nairobi politics. How will the chips fall in the race to replace Mike Mbuvi Sonko as Nairobi governor? Well, this is the question currently boggling the minds of city